Well, citing needs for more manageable workloads, members of the Hawaii Nurses Association have walked off the job at the Kapiolani Medical Center for Women and Children, and our Robert Buon has the latest.
As nurses strike for a second day at Kapiolani Medical Center, management can agree with them on one item. No one wants to be here.
We do not want to be in this position, and we didn't choose to be in this position.
It's really hard. I feel bad for our patients because they have nurses taking care of them that don't know the units, don't know where things are.
At the core of the labor dispute, nurses pushing for defined nurse-to-patient ratios, what they feel are fair and manageable staffing levels. Union leadership pointing out the irony of how current temporary staffing is exactly what they're asking for.
Right now, they have travelers in there, and there's 2 travelers to every patient. So they have 30 nurses working, where we usually work with maybe 18 or 19. We want safe staffing. We want safe ratios so we can take care of our patients better, and that's the whole point.
Hospital management didn't address the imbalance between the number of nurses brought in for this week compared to usual staffing levels, but acknowledged that current caseload is paramount in determining scheduling.
So we are looking at our staffing a couple times a day to make sure that we have the right staff at the right time to provide the care. So we may have 18 nurses this shift, we may have 24 nurses a shift. That changes depending on the types of patients and how sick they are.
Nurses will not be paid for this week. They've walked off the job. But for a group that hasn't had a strike in over 50 years, union leadership says the time to be heard is now.
We're just telling the community, hey, if you're unhappy with this and you're seeing the nurses out here, go call the employer. Call Ray Vera, call Gidget, and say you are unhappy. Get the nurses back in. Let's meet at the table.
Both sides have agreed to go back to the table January 31st and February 1st after the one-week strike comes to an end. From Kapiolani Medical Center for Women and Children, Robert Buon, Island News.